What's up, everybody? Welcome back to my channel. My name is Bree and I am a LPN. I've been an LPN just a little under 2 years now. So today's video is basically about if you should become a CNA before you should become a nurse. Is it necessary? Do you have to do it? And honestly, it depends on you and it depends on your motive to become a nurse, in my opinion. So the short answer is no, you do not have to become a CNA before you become a nurse. I have worked with nurses that have never been a CNA before, and they are amazing nurses. So it just all depends on the person and all depends on the motive. And honestly, I'm gonna tell you right now, if you are someone that is becoming a nurse for the money, then I don't think anything is wrong with that, honestly, because a lot of people go into a lot of different professions for the money. But honestly, if you are becoming a nurse solely for the income, then I'm gonna tell you now, the answer is no. I don't think that you should become a CNA before becoming a nurse, because I think that the role of a CNA might make you dislike the nursing profession as a whole, which once you become a nurse, and if it's something that you're just doing solely for income, you're not gonna like becoming a nurse anyway. So if that is you in your situation, then I'll just keep it short and brief. The answer is no, that you should not. But if you're someone like me and you feel like nursing is like a calling for you and it's kind of like part of your life path and all of that, then I have some pros and cons that I listed of becoming a CNA before becoming a nurse. So yeah. Basically, when you become a CNA first, it opens you up to the nursing profession. You're able to see firsthand the role of a nurse. So I think that is a pro in itself, because you're able to see like what your job entails and also how to handle the role of being a CNA. And I say that because if you are a nurse, a CNA's job is essentially your job if there is no CNA to fulfill that role. Meaning that a nurse should be able to do the things that a nurse assistant already does. Because if every CNA decides to walk off that day, your patients are still your patients. Me being a nurse and being a CNA prior has definitely helped me in my role as a nurse. I don't really have to stress out if I don't have a CNA or if I don't have a tech. Knowing how to do those things at the basic level will definitely give you more confidence in your role. Another pro is that you know how to delegate tasks to CNAs. Because I was a CNA before, it wasn't hard for me to be able to know how to communicate with CNAs and tell them what I'm expecting without saying it in a bossy, condescending way. I've been a CNA before, so I know how I would like for my nurse to speak to me. I know how to communicate that to my techs and to my CNAs that are working with me during that shift. And I know how they expect to be treated, and I know how they deserve to be treated. And this is not for every nurse, but I've seen it, so I can speak on it. You find that some nurses don't really know how to talk to CNAs because they've never been one, or they can just be honestly just nasty because they don't understand the role and they don't understand what CNAs do. I think that a lot of CNAs and techs that I work with have, had a lot of respect for me because they know that I respect them. That is a definite pro, because when you are working, you want things to be cohesive and you want a strong team and you want everybody to be on the same page. And by being a CNA, before becoming a nurse, there is really no communication barrier, if you understand what I'm saying. Like, everybody understands their role, everybody understands what we're here to do, and that is just another pro of becoming a CNA. A big pro for me, honestly, is I was able to get a picture of nurse scheduling. A lot of nurses know that you work 12-hour shifts, you work, AM shift or you work PM shift. But when I was a CNA, I worked at a facility that did 3/8. You either work 7 to 3, 3 to 11, or 11 to 7. I was able to get experience on all 3 of those shifts, and I was able to determine which shift would be best for me when I became a nurse, so that I knew like what schedule that I wanted and what was going to work best for me and my family. And I think that is a definite pro. Instead of kind of going in blindly about the schedules and what's the like the pros and cons of each schedule. Like, you know, day shift is really busy, 3 to 11 is kind of chill, but you've got to deal with you know, evening things. And then you have your like your 11 to 7 shift, which is like, you know, pretty laid back, but you also have their tasks that you do at night as well. And I think that is a definite pro to have that kind of insight before, you know, committing yourself to a facility, a contracted job, or anything like that. Another pro is the experience that you get just working in the healthcare field. A lot of recruiters and interviewers that I've spoken with have said that they like when nurses wear CNAs before, because it shows growth and it shows that, you know, this is something that you really want to do. And they think that, you know, you might go on to get your RN, or if you are RN, you know, you'll go to get your BSN. It just shows that you're committed and that you're dedicated. And it looks really good on your resume, especially if you're trying to get into somewhere specific. That CNA experience will definitely help you stand out amongst the rest of your peers. Sometimes you can work as a tech at a good company, or a company that you already wanted to work for before becoming a nurse. And that is great as well, because a lot of companies offer really good benefits, such as tuition reimbursement or student loan repayment. And that is a very good benefit, especially to me, if you're looking to go back to school and you want to further your education. So the last pro, and I'm pretty sure I'm missing out on many others, I think that you appreciate your techs more. You appreciate your CNAs more. Like, I know for me, I definitely did. I worked as a CNA for, let me see, I would say like a solid 6 to 7 months. I started in June, and I think I left at the end of February of the following year. And I worked really hard, and I was able to see like the judgment on CNAs. I saw how some people treated me, and it just makes you appreciate their job and what they do and how hard they work. And basically, like, without them, it would be so hard for nurses to do their job, especially if we had to do everything a CNA does and do med pass, and, you know, just deal with physicians and things like that. Like, it would make the job like unbearable. Like, I don't even think that I would be able to do it. And so it makes you appreciate them more. It makes you want to make their jobs easier. It makes you willing to help them, because at the end of the day, we're all a team. And if everybody can come together and help one another, that is what's best for the patient. I did enjoy my time as being a CNA when I became a nurse. I really did enjoy the CNAs that I worked with, and I have made so many friends and so many, you know, acquaintances just from that. So those are the definite pros of becoming a CNA before. So if that sounds like you, if you think that you want to do it, or if you're, you know, feel like in your gut, like, I think I want to go ahead and do it, get the experience and just get the understanding, then I definitely think that you should. Okay, so let's talk about the cons to becoming a CNA, because there are definite cons to becoming a CNA. All right, so the first one I have, and this is not in any specific order. Being a CNA may make you not want to be a nurse at all. Like, it may throw you completely off of the profession altogether. You may just be turned off from nursing just because that's not necessarily a bad thing, because you can kind of see firsthand, like, oh no, this is not for me. Like, you may see that even nursing is not for you. And I don't think that's a bad thing, but it is a definite con, especially if, like, being a nurse is your dream and you're not going to be a CNA for long. Like, just because you have to be in this role doesn't mean that you don't have to, like, you have to not be a nurse, or you're not going to be a good nurse. It does not mean that. It just, you know, maybe being a CNA is just not for you. Okay, so the second con I would say is the pay. The pay sucks. Like, it's just, well, it just depends on, like, your financial situation. I'm not gonna say that it sucks altogether, because I've seen, you know, some CNAs in better situations than nurses, and, you know, better financial states. So I'm not gonna say that, but for me, the pay was low, and it's a lot of work. It is a lot of work for what you get paid. Overall, like, just at a normal facility, working at the hospital, you're not gonna really make that much. So the next con that I have is the disrespect. I feel like when I was a CNA, I saw it was just like a lot of disrespect. You get a lot of disrespect from patients. You get a lot of disrespect from your peers. You get a lot of disrespect from your superiors. You get a lot of disrespect just period, because a lot of people just think you an ass wiper. CNAs do way more than that, and I know firsthand from being a CNA myself. It's just I think the profession as a whole is just disrespected and looked down on, and I don't like that. you know, the condescending remarks and people, you know, saying snide things to you. And I felt like I had to defend myself, and I felt like I had to defend the profession as a whole. But honestly, you can't, like, if this is something that you're gonna do, you gotta do it from the heart. You gotta do it knowing the bigger picture. The last con that I have is the exposure to bodily fluid. I have been exposed to bodily fluids with both professions, but CNA is off, like, automatically off top. Like, that is just, like, you're just exposed to so much. You see so much, you gotta clean up so much, and it's really, it can be a really gross job, honestly. And it's, you know, there's no sugarcoating that. That's why I said it has to be something that you do from your heart, and not, you know, for anything else other than, you know, other than that, because it's a job that does not pay what it's worth. So that is all I have for this video. I hope I was able to give you all some insight on becoming a CNA before becoming a nurse or not. Hopefully this helped. If you have anything that I missed, please leave them down in the comments below. And thank you so much for watching this video. Subscribe to my channel, and I will see you all in the next one. Bye.